Scene 1. Introduction. Welcome to the unit. Provide individualized support. In this video, we will focus on how to identify requirements outside your own job role and seek appropriate support while meeting your legal and ethical responsibilities as a care worker. These skills are critical for safe practice and will be assessed through workplace simulation. Scene 2. Understanding scope of own job role. As a care worker, it is essential to understand the scope of your job role. Your scope of practice is determined by your job description, your training and qualifications, your organization's policies and procedures. You must know what you are qualified to do, what you are not permitted to do, when to seek support from your supervisor. Acting outside your scope can place clients at risk and lead to serious consequences. Scene 3. Legal and ethical requirements. To understand your role boundaries, you must apply key legal and ethical requirements in both organizational policy and individual practice. These include 1. Code of conduct, acting with honesty, integrity, and respect. 2. Duty of care, taking reasonable steps to prevent physical, emotional, or mental harm. 3. Dignity of risk, respecting a person's right to make choices while reducing risk. 4. Privacy and confidentiality, protecting personal information. 5. Human rights and non-discrimination, treating everyone with respect and fairness. 6. Mandatory reporting, reporting abuse or neglect according to policy. These requirements guide how you decide whether a task is within or outside your role. Scene 4. Work role boundaries and limitations. Work role boundaries define what you can and cannot do as a support worker. Examples of actions outside your role include diagnosing illnesses, providing counseling or therapy, changing medication dosages, delivering support not listed in the individualized plan, maintaining boundaries, protects clients from harm, maintains professionalism, prevents stress and burnout. When a request is outside your role, you must not proceed independently. Scene 5, Simulation 1, Client Request Outside Scope. Medication concern.
Can you increase my pain medication? It's not working.
I'm not authorized to change medication, but I'll report this to my supervisor and help you speak with the nurse.
The worker correctly identifies the task as outside scope and seeks appropriate support. Scene 6, Dignity of risk and duty of care in practice. Sometimes client choices involve risk. This is known as dignity of risk. Your role is to respect the person's choice, reduce risk where possible, act within duty of care. You must never remove a person's rights, but you must also act to protect their safety. Scene 7, Simulation. 2. Balancing choice and safety. Client wants to live independently.
I want to move out and live on my own again.
I respect your decision. Let's talk with my supervisor about how we can reduce risks while supporting your choice.
This demonstrates dignity of risk, duty of care, and appropriate escalation. Scene 8, Seeking support from supervisor. When needs fall outside your role, you must report concerns to your supervisor, follow organizational procedures, document actions taken. Seeking support is not a weakness. It is a professional responsibility. Scene 9, Simulation 3, Reporting and documentation.
Client requested support outside my role. Supervisor notified, awaiting further instruction.
Accurate reporting ensures safety, accountability, and continuity of care. Scene 10, Key assessment messages. For assessment, you must demonstrate that you can identify tasks outside your job role, apply legal and ethical principles, seek supervisor support appropriately, Maintain professional boundaries. Assessors will observe how you make decisions, not just what you say. Please review pages 71 to 76 of your learner guide and reflect on how role boundaries protect both clients and workers. Thank you for watching.